Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Lucia Mullen and Crystal Watson of the Johns Hopkins Center for Health Security. They discuss the many factors that colleges and universities must consider as they weigh reopening in the fall. Let's listen.
Thank you both so much for being with me again.
Thanks a lot.
It's our pleasure.
So today I'd like to talk about universities. There's been a lot of talk about whether it will be safe for students and professors and everybody else involved in a college education to come back to school in the fall. And I think lots of different universities are taking lots of different tactics. I saw that at Yale University, the freshmen can come the first semester and the sophomores can come the second semester. I think a lot of the education will be online. I think it was out in California that schools just aren't having in-person instruction. And then you see sort of hybrid models. So I'm wondering let's just start with, can schools safely reopen universities in the fall?
I think we're going to find out. There is a lot to consider when you're talking about reopening and bringing students and faculty and staff back together in person, in large numbers in particular. And we do know that COVID-19, the SARS-CoV-2 virus, spreads more readily in congregate settings and large gatherings, particularly indoors. So colleges and universities are giving a lot of thought as to how to make that much safer. It will never be 100% safe, though. We know we're going to have cases of COVID-19 on college campuses, and we've already seen that. The idea is really to make it as safe as possible and avoid big epidemics of the virus.
So to me, college seems sort of antithetical to social distancing, right? I mean, kids all live really close quarters. They go to parties, and even if they're not going to parties, they're all hanging out together. I mean, we've all seen like mobs of freshmen walking across a college campus. So how can universities deal with those factors? Lucia?
Well, I think you hit it on the head there. It's when we're talking about colleges or universities coming back, they're not going to come back in a way that they have in the past with large group settings, with student life in the same way that we've experienced it. So when we come back, a lot of that's going to have to change drastically in order for it to be safe.
Mm-hmm. Well, how do you get kids to do that?
It's hard, and it all comes down to communication. The students are going to have to be just as important and responsible in making sure that these factors are implemented, as are the faculty, as are the administrators. It is all going to require effort from everyone that's involved in the university.
But young people think they're invincible, right?
I think that's often a misnomer. Some do, but I think with the right communication, and this would be the university's responsibility up front to make sure those messages are put out, I think you can get them to engage and start thinking about how their actions may lead to the university having to reclose or to some of their clubs having to reclose. So I do think that if they're given the right tools, we could have them looking at this from a risk-averse approach and from a safety approach rather than thinking they're invincible and not really considering the consequences.
Mm-hmm. So, Crystal, I did see, I think it was University of Michigan, who's asking everybody to quarantine for 2 weeks before they come back. And I think that's an interesting approach. I've also heard that some are considering testing everyone before they come, but that is not what the CDC is giving guidance. So what do you think a good approach there is?
Yeah, I think the idea with both of those approaches, both quarantining before you return to campus and testing upon arrival, or even right before you come to campus, is to prevent that initial introduction of cases onto campus when everybody moves in. I think that it's possibly beneficial. It would be nice to know that you don't have, or you think you don't have many cases coming into the university right away, but it really is just one point in time. And so I think that's why CDC hasn't issued guidance to that effect, because you could have people exposed in the community the next day and introduce cases to campus. So what I think we don't want to do is give people a false sense of security that if they've tested negative or if they've quarantined before they come, that they're not going to be, they don't have to take the measures that keep them safe when they get there. I think people will understand that, but I don't think it is a silver bullet to do those things.
So let's say college is open and everyone comes to campus, and then you see outbreaks. A, I guess, how possible is that? And B, what do you all recommend in terms of how you decide where to go from there?
I think it's quite possible. And this is something that needs to be a key factor in the university's planning safety guides beforehand of what is the trigger to shut down or to reduce their operations depending on how many case numbers they have. And so this is something, if they can decide beforehand, then they know how to react and they've got a plan in place rather than scrambling once it's happening and not sure where that threshold is.
Mm-hmm. Do you think the kind of threshold, Lucia, that they should look at is sort of like if they have X number of cases, they should do this? I mean, I'm just sort of wondering what kind of thought process you're recommending.
I think a lot of it, I would be apprehensive to put a certain number on it because it depends on, the group. Was it the football team? And so it's very connected to the athletics and the sports game, and they're able to close it there. Or has it already spread past to other areas of the campus? And a lot of it also depends on what other measures they have in place. Do they have a quite vast contract tracing program in place, or is that not something that they have the resources to implement? So it's something that they need to work with their health departments, their local health departments, either in the community or in the state beforehand and decide what those thresholds should be.
Mm-hmm. Krista, you guys have created this report. It basically is sort of things to think about as you look toward reopening. Can you sort of give me the major things you want colleges and universities to think about when they're trying to figure, I guess, the risk? Because this is all about mitigating the risk.
Yeah, so it's about health and safety risks, certainly. We have a tool that's included in this toolkit that helps the universities assess their risk based on their student and faculty and staff populations, where they are in the community, what's happening with the spread of the virus at the time of reopening, those sorts of questions. And then gives them a list of what we think are some of the key mitigation steps to reduce that risk. And it really allows universities and colleges to see, after they have taken those mitigation steps, where does their risk still lie, and does that make it possible and advisable for them to come back in person. So those health and safety steps are really the most important thing here. But I do think that there are other issues that colleges and universities have to consider, like the quality of their academic programs. So it should be top of mind that kids need to get out of college what they should when they're coming back in person. So if the measures we're taking to make it safer for them to return really have a detrimental effect on the quality of the education that they're receiving, we have to balance that and see if it's worth the risk of bringing them back. They also have to look at financial resources, because these mitigation steps cost a lot of money. And does it make sense financially for the university to do that? And finally, they need to make sure that they have the management and oversight and planning process and leadership in place to really keep track of what's going on, have a clear vision for what they want to do in an age of COVID, and then have protocols and policies in place that will protect everyone on campus to the extent possible.
Universities really have a huge financial pressure to open. And also, college is an experience that you have in person for most people. So, and that's the ideal, right? To be on campus, to socialize, to be with other students your age. Are those factors potentially going to outweigh some other potential safety factors?
They may. And that's why it all comes down to both the students themselves need to address their own individual risk and determine, once they find out what the safety measures are that the college has implemented, is it worth them going back and is gaining that experience? And because it is all part of growing up, of not just the classwork, but everything else that comes with college, is it worth the risk to them? Same with the faculty and everything. So there's a lot of individual decisions that need to be made once the university has decided whether to reopen and how they're going to reopen.
Mm-hmm. This feels like it's going to be very patchwork, but I guess that's because we're having a patchwork epidemic as well, right?
Yes. And, it goes back to, this is a new disease that we didn't know about 6 months ago. And so a lot of the science is catching up and it's moving fast, but we have to keep adapting as new evidence comes to light. And it's going to be the same thing when universities reopen. As you'd mentioned, many universities are doing different things or implementing different decisions in their reopening plans. We will soon see which ones might be more effective and which ones might not. And everyone needs to be able to go in with the mindset that we may change plans and change guidance. And so we need to have that adaptability.
Mm-hmm. Crystal, if I had a child going to, say, the University of Florida, in a month or whenever they reopen, I'd be afraid to send my kid to Florida right now. The situation could change in a month. But how will those factors play in?
Yeah, universities and colleges are not islands unto themselves. They exist in the communities that surround them. And so if there is a high incidence and prevalence of COVID-19 in the community, in the surrounding community, I would expect that to be mirrored on campus. And so that is going to have to be one major consideration, both of leadership of these institutions, as well as parents and students and faculty and staff, as to whether they should come back, because certainly I would expect more cases on campus if there's a big epidemic locally.
Mm-hmm, mm-hmm. And we talked a little bit about finances a minute ago, and I wanted to ask this question, which is, my stepson is about to be a sophomore in college, and he and his friends are kind of thinking, is it worth it financially? Is it worth it for me financially to send my kid to school for a year that may not really happen, that may be a patchwork here, online there, it may not be the quality that I thought I was paying for, and they may choose to take a year off. Is there a concern among colleges and universities that this could be a real financial blow?
I think that is a major concern. While it's really important to keep students safe, and that should, I think, be the overriding concern, we can't avoid that colleges and universities need revenue to operate, to continue on. And so if students decide to take a year off, or if they don't want to pay the tuition that they would have paid if they were coming in person, if they're going to be online, that is going to be a major hit to budgets of these institutions. And so they will have to decide how viable it is to continue programs during the next year if they have a big drop off in people willing to come.
This is a lot to think about as we move forward here. And the universities have a lot to think about, parents have a lot to think about. And thank you both for bringing your perspective.
Of course, thank you.
Thanks so much, Stephanie.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.